we're at a point now in the discussion where we want to bring in other voices you sometimes don't hear in these kinds of sessions. And really, that's what Duty of Care is all about, the content series I mentioned earlier in the day. First of all, if you haven't had a chance, check out Duty of Care. There's a lot of really fantastic content that colleagues like Amruta and others have put out there, and a lot of content from our community, opinion articles and other things. But one thing I really want to draw your attention to right now are voices from people who are on the front lines. That's the whole point of today's session. And so I'd like to ask the producers to cue up a video. We have a message from Jeffy Otavi, who is a midwife at the Muhimbili National Hospital and is with the Tanzania Midwives Association and the International Confederation of Midwives. And we just want to hear at this point from her to get a take from her perspective. And then we're going to come back to some more poll results, and we're going to come back to another video, and then we've got some more exciting information for all of you. So stay tuned, and let's hear from Jeffy now, please.
My name is Jeffy Otavi. I'm a midwife. I work with Muhimbili National Hospital. During COVID-19, we have faced a lot of challenges as a frontliner because we are directly taking care of these patients. When we rest with them, we have been treating them as a normal patient, but we have been taking care of ourselves by using the available PPEs, and we trying much at least to separate them and put them in a place whereby they'll be more comfortable and more secured, and even to protect others, because as we know, the pregnant mother are always at risk in getting further more infection because the immunity is low. My message to a global community is we have to take care of ourselves. If you take care of yourself, it means that you take care of others. So make sure that you're not putting yourself at risk in getting infection. Be safe, stay at home, and protect yourself.
My thanks to Jeffy for that message. I think he has an important message, because often in these discussions, we're thinking about COVID itself, but of course, women who are pregnant, who need prenatal care, who need to give birth in a quality healthcare facility, COVID has really upended a lot of plans of pregnant women, and it's created fear. And I think midwives like Jeffy are doing a really important job in reminding all of us that we all have a role to play in this. So it's great to hear his message. During the course of this conversation today, there have been some polls. You've seen them on the side of your screen, and many of you have participated in that. And I just want to tell you a little bit about what we've found in these polls. There's some interesting numbers. So first of all, we were asking what's the most important thing healthcare workers need? And the vast majority, 65%, said really it's about the entire healthcare system being strengthened. A much smaller percentage talked about compensation and training, fair compensation training opportunities, and about a quarter of access to adequate equipment and medical supplies. But really, it's clear that the systemic issues are coming through. I'll say more about that in a moment. It's all about the whole healthcare system, not just about the healthcare workers themselves. We asked another interesting poll question about what's the best way to address the shortage of healthcare workers. Right now, WHO says it's 18 million is the shortage. It's massive. And here a majority said it's by upskilling and reskilling staff at different levels. In other words, by taking measures to avoid brain drain was a relatively small number, 16%. By training more healthcare personnel, 30%. That takes a long time. But a majority say, hey, let's upskill and reskill staff at different levels. That's a much shorter term potential solution. Interesting to hear the take from obviously a lot of experts in the field who are joining this call today. And then finally, what should global health leaders pay more attention to? This is interesting. A majority say advocate for more investments, again, in health systems. You might have thought they would have just focused on health workers. We have a quarter who say ensure healthcare workers are fairly compensated. 2 in 10 say advocate for more political will to increase health budgets. But a majority are saying advocate for more investments in health systems. And again, I think the systems question here is really critical, maybe not totally expected if you think about an event like this focused on frontline healthcare workers. So we'll come back to that systems question in just a moment. But I want to just say before we do that, that we've got another message, and this is our last message today. It's from a nurse, Matias Videla, and he's a nurse in Salta, Argentina. And let's hear what Matias has to say.
Buenas, ¿cómo están? Mi nombre es Matías Videla, soy asesor de salud de la provincia de Salta. Estaba acostumbrado al contacto directo con las socias día a día. Ahora lo realizamos desde casa. El compromiso con ellas sigue siendo el mismo, creando un sistema de atención virtual donde evacuamos sus dudas a través de llamadas telefónicas. También realizamos capacitaciones brindando información validada, campañas de diferentes temas como por ejemplo el ciclo menstrual. Ser parte de esta gran lucha contra el COVID-19 se siente muy gratificante, con una responsabilidad enorme. Les quiero dejar un mensaje a todos y todas a nivel global. Es motivar a seguir cuidándonos unos a otros siguiendo las medidas de prevención de la Organización Mundial de la Salud, ya que todos necesitamos poner nuestro granito de arena para salir de esta situación lo antes posible.
Well, when we're ill, we're used to listening to nurses. Hopefully we will all listen to this nurse. Matias, thank you for that message. And it makes me think about one of the takeaways I'm getting from the day so far, and we're not over yet, but that's really about the importance of health systems. You know, health systems are a hard thing to understand. You don't really feel or touch the system, right? It's quite abstract. And I think most patients, most citizens, they know about their touch point. They know about their doctor or their nurse or their midwife. They know about their community healthcare worker, their clinic, their pharmacy, as Farhan mentioned in the last session. But do they know about the system? Well, I think one thing this pandemic is doing is it's showing the system to all of us, right? Average citizens are really starting to see the systemic nature of how healthcare works. They're thinking about things like, well, if I get ill, can I get a test? What kinds of diagnostics are there? What about tracing that contact to know if other people in my family or friends or colleagues might have picked up the virus? They're thinking about more broadly, if I get seriously ill, is there a supply chain for medicines or in the future vaccines? Can I get to a healthcare facility that will have respirators or oxygen? So we're starting, I think, to see what a system actually looks like. And when it doesn't work, why systemic problems are so hard, why you can't just solve it with some one-off intervention. And I think the experts who have joined the session today, and I again thank all of you who are from all over the world being part of this, you know this well, that there is no one simple solution. Well, we're just going to pay people more, or we're just going to hire more. This is a systemic issue, and it's going to require a different mindset. So one of the key takeaways for me, and I think the poll results emphasize that, is that these systems really matter. And I know Gitinji Gitahi is a doctor and the head of AMREF worldwide. I quote him in my book. He's constantly said that, you know, we don't do UHC because we're rich. We do UHC because we're poor. I think that very same sentiment applies to these health systems. It is cheaper, it is more effective to invest in the system than to try to put on a short-term solution when there's a crisis. And I think that's come out very much in today's session. I think key issues of equity have come out as well today. This idea that healthcare workers face stigma that needs to be pushed back on, that they face pay inequities, that there should be real and basic compensation for them, that they face challenges around training and tools, and that in particular, a very high percentage of the frontline healthcare workforce are women, and yet a very low percentage of healthcare leaders are women. And so you see maybe a healthcare system that isn't designed for the very workforce that we have, and that we need to take that more into account and do a lot of what I think we've tried to do today, and that's listen to those frontline healthcare workers. Last takeaway for me is, you know, we've talked about money a lot today. It's come up many times, and financing is a key issue. If you were to look at the richest countries in the world, and of course, many of them are facing huge challenges with this pandemic, they spend on average something like several thousand US dollars per year per citizen to provide healthcare. In much of the low income countries of the world, low and even up to middle income countries, the annual spending per citizen might be $50 to $250. So we're talking about an order of magnitude less. We're not going to bridge that gap entirely just by moving funds around within a government. That might be a part of the solution, but it's clear as we've listened to the experts talk today that we need to start thinking bigger about financing, that we need to set some floor for primary health care, and that there needs to be a bigger commitment from the world to ensure no one falls below whatever that floor might be. I think that's a big takeaway as well for me listening to this conversation, that if we care about systems, we have to care about financing. Dr. Paul Farmer has a phrase he often uses, the idea of socialization of scarcity, that we get used to, maybe in the global health field, we get used to the idea that there's a scarcity of funding. And if we get used to that, we might not advocate for more. And this is a moment when governments around the world are standing up huge multi-trillion-dollar initiatives around fiscal stimulus for their own wealthy economies. This is the moment to say, wait a second, we need to also be investing in the global health, primary health systems for every person on this earth. It's a unique opportunity to do that when we face a pandemic that's had such tragic results for so many people. So I really want to thank everyone who's been part of the session today so far. I've learned a lot. I hope all of you have as well. And it's been a real honor to get to listen to people who are on the front lines of this.